I'm good.
Okay.
She loves watching your stuff.
I know. You all right? Okay, good. He's got a bunch of lipomas. He has a family history of them too. I think his father has had them. So, not surprising that that's what these are, and it is confirmed. I can see that that's what this is. I'm not hurting you at all, right?
No.
Good. Let me just see if I can squeeze it out of this. Did you feel that coming out?
No.
You didn't? You have a little baby.
That was such a good pop.
Yeah, he's like, whatever. He's like, whatever makes you guys happy. You're a good man.
Thank you.
Let me take a little stitch on there. Let's do this one completely. What I might do is just some sides. Let me see what angle I can get with this. You gotta have it in weird positions to make me do like gymnastics or something in here. Can I give a shout out to where you work? I can say no. You can say no, by the way. You don't
No,
want people
I'm
to.
not allowed to.
Oh, we're not?
No.
Really?
We're not press release, no.
That's interesting. But I wonder if it's not like that's interesting.
Yeah, they're very much.
Huh? Yeah, because you never know. I suppose.
Yeah,
I mean, and then I could say, you can find this in the aisle, the
Yeah,
grocery,
yeah,
the
right.
frozen aisle or something, and then they'll pick
I mean,
stuff.
a lot of
And
people,
then I get in
a lot of people
trouble.
do it anyways, but employees are not allowed.
Yes,
to.
got it. So now everybody can just guess.
Yeah. I'm gonna send a link to all his family members.
Oh yes, they'll all know. I'm sure. No more rubbing on the table with this lipoma.
That's very true.
What do you think? We have to show you the shape of it and see if we can decide to name it. Sounds like she likes to name things, so we'll have to see what she thinks.
I think it's gonna be like Little Bubba.
Little Bubba.
Little Bubba.
Well, we'll see what the other one. Well, let's see them both, because you gotta. If you have twins or you have birth to two. Let me see that for a second. You can't just name one without seeing the other one. It's not right. Get that right. Okay. Gonna give you the set right here. Let me see. Thank you. There's 4 stitches on there, so just keep that in mind too mentally. More stitches here than we usually have on the chair, on the table that is. I'm doing a running stitch over here, so my wife is gonna have a fun time. If she wants to remove them, she can. Though I know you guys aren't too far away from us, so if you want us to remove them, you can. But they're actually 2 separate trips because you can leave this one in for longer. You can leave this in for 14 days before you take it out. This one here.
Okay.
It's one of those running subcuticular. If you see a lot of the videos, the ones that wind underneath.
Right.
So, and you just have to snip one knot, but we'll go over it again with you specifically, but you probably already know. You can do that. That's fine. Let's move it out of the way a little bit. Nice and flat there. Put this last stitch in, she'll take a little picture of it, and then she's gonna put a bandage on it while we switch to the other side. Just put one in and out. And let me just one more, just in case, 'cause I felt like that one didn't go. Okay. Okay, you shouldn't also, again, not feel anything here. You okay?
Mm-hmm.
Let's see where this one is here. I'm a little more careful, obviously, in this area because the skin is thinner here, so I just want to make sure I get it. Feels like this one's a little bit more stuck on you, maybe, but let's see. Are we making you sweat up, Christy?
No, I'm actually okay.
Oh, okay. I don't know. Maybe.
My glasses were falling.
Oh. I need a strap for your glasses. You okay, right?
Mm-hmm.
Let me see this one. I'll squeeze out. Looks like it's kind of stuck to you. The other baby was definitely more behaved. We'll get him, but he's trying to fight us a little bit. Trying to just get him out of a smaller hole is the problem. I think because he's actually a little bit bigger than he looks. No, that's it. He's just stuck by something. Let's see what he's stuck with. Have you had this one for longer? Same amount? You don't know?
I
No?
think no.
But it
My-
became more annoying to you, I think, this one sooner.
Yes.
I see him right here. Just, he's kind of has this little netting around him, so he's not, it's hard to sometimes tell what's normal fat and lipoma fat. So I don't want to take out much regular fat because then you have like an indent there. But this is him. He's stuck to you. Let's see here. There you go. There he is. He's under there. She can tell the difference. See, it's like kind of tied in
Mm-hmm.
with these, it like looks different, you know? But he's stuck to you. I hope you don't mind her. As long as it's her making those comments, not me, right? I'm not like, oh, ooh.
Right.
Yes. I'm using something called, just trying to, what's it called? I'm trying to get it out without actually cutting, just kind of spreading the skin here a little bit. That one was a little tough little sucker, let me tell you. Make sure I caught it all. Let me take a look at it now again. It was like a little bumbling one kind of thing. Gosh, am I hurting you? I think that one might have been a little bit under a layer of muscle there. That's why it was a little harder to get to, but not exactly sure. Let me feel around. So we have numbing in there, which also makes it look fuller.
Okay.
A little still, like it looks fuller down here, but I actually feel, and I don't feel anything under there. So that's good. So yeah, I think that's good. We got it. It's an interesting one. Okay. Now where's my instruments here? The show's over. See, she knows. So this one is a week. And because it's a week, we don't leave the stitches in for that long. I'm not so worried about like a track mark, as we say.
Okay.
So they're individual stitches. Because then you can, they're gonna give it more strength because there's more than one stitch. And, but they get taken out in 7 days. So, I mean, you can certainly make that appointment for us to do that. Why don't you do that, and then if you decide, I don't know, who you wanna, do you know what I mean?
Yeah.
But the one on your arm, I think you can definitely do that because it's just one stitch.
Okay.
So maybe you come back for this, you don't live that far anyway. Almost done now.
Is there anything that Robert could do to not, like maybe diet-wise, so that they won't grow, or is there? Because he has other ones, and
right. No, actually, unfortunately, there's nothing you can do to prevent it. It's just a genetic thing. There must be some genetic thing that we don't know what it is exactly, but something that predisposes you to this. You know, it's passed down from his dad. I think his dad had this, so. Do this way, then I'm going to turn the other way so that it won't be on your face. I think there's going to be 3 or 4 stitches right here.
you can say you were in a knife fight, like with your
Yeah, you
scar.
can. And it came in through here and it came out through your arm.
You can see I could see the other guy.
Yes, that's right. She has been watching my videos. She knows that I like to say that.
Oh my goodness.
Yeah, you got a lot of videos. You got a lot of catching up to do, so you can talk with us.
I guess.
We're not gonna hang out with you until you know everything that's going on.
Right.
You think we could convert him to watching, or is he like get grossed out? No, he's done, huh?
No, he's a little squirmish.
You know, it's okay. He's got other things that let him get done with things that you don't want anything to do with during that time. That's your time.
Wow.
Robert went through a pretty serious medical situation
Oh.
years ago, and I got to watch that procedure.
Oh, you had chicken in your arm and chicken in your neck.
You had chicken nuggets in your
In the
arm.
morning, chicken in the evening.